HPV infection is responsible for around 2.5% of all cancers in Europe. That's around 87,000 diagnoses per year. But almost all these cancers are preventable. We already know how to achieve prevention, and we have the tools available. Cancers that affect both men and women include everyone with a cervix, anus, penis, and throat. We now call on the European Union, the World Health Organization, and individual European countries to take action as soon as possible. The World Health Organization's new global strategy for tackling cervical cancer, published very recently, provides a platform to focus our efforts, and perhaps more importantly, the European Commission's new Beating Cancer Plan provides the opportunity for European countries to take the lead in eliminating those cancers linked with HPV. The European Cancer Organization's new report, Viral Protection: Achieving the Possible, provides an evidence-based 4-step plan to be applied in the European region. This report has been developed and endorsed by a wide range of organizations and individual experts, and will form the basis for a sustained advocacy campaign by our multidisciplinary HPV Action Network over the next 12 months and beyond. I now will talk about the first 2 steps of the campaign, and my colleague, Rui Medeiros, will describe the other 2. So the first step is to ensure HPV vaccination for all adolescents across Europe. We know that HPV vaccination prevents cancers in later life. Only last week, a major study from Sweden confirmed the impact that HPV vaccination has on reducing the incidence of cervical cancer. However, a quarter of European countries still don't vaccinate girls, and just over 1/2 don't yet vaccinate boys, or plan to do so. Also, few European countries meet the widely accepted target of 80% vaccination coverage. And over the past 6 months, we know that vaccination programs have been seriously impacted by the COVID-19 pandemic. So, we are now calling for all European national cancer plans to include actions to achieve population-based and gender-neutral HPV vaccination, and for programs to be operational and achieving 90% uptake by adolescents by the year 2030 at least. This is a bold, but we believe an achievable goal. The second step concerns cervical cancer screening. This is essential as it detects precancerous changes at a stage when they can be more easily treated and prevents cervical cancer developing. Almost all cancers in this group are preventable, and countries in Europe already have cervical cancer screening programs, but they vary in terms of outcomes and effectiveness. In 16 countries, for example, these programs are opportunistic rather than population-based. This means that their success depends on the initiative of individual women and their doctors, resulting in uneven coverage, but also less consistent quality assurance, limited impact, and less cost effectiveness. We now want to see all European countries' cancer plans include the goal that by 2030, at least 70% of women in Europe should have been screened for cervical cancer with an appropriate high-precision HPV test within the last 5 years. We are also calling for screening programs to use high-precision HPV testing and to offer many more women the opportunity to use self-sampling as a way of increasing uptake, especially during the COVID-19 pandemic.